Today I'm showing you why Chiari I malformation, which is called Arnold-Chiari malformation, causing syringohydromyelia. So basically, here's a sagittal view of the here's the mouth, here's the nose, here's the spine. There's water, basically flowing water in the middle of the spinal cord. Normal spinal cord should look like this. Why? Because of the CSF flow outside the fourth ventricle outward through the foramen magnum. They are being compressed. There's not much space here because of the cerebellar tonsil extending below the foramen magnum, resulting in obstruction. Let me show you what does a normal look like. Here is this patient that underwent surgery, resecting part of the bone and give more space, so there's more CSF flow around it, and then there is less syringohydromyelia after surgery. Only 5 months later. Now, 5 years later, the syringohydromyelia is gone, and the CSF flow normally. And there is a new MRI technique to highlight the moving of the brain that normal MRI does not show such motion. This one is a video that shows it. See this one shows the motion with the pulsation and CSF pulsation, the position of the artery and position of the CSF. You can see that normally there are motion here. You can see that if there's extra tonsil tissue blocking the CSF drainage, and also blocking the CSF coming out of the foramen Luschka and the Morgenti downward, and also blockage of the CSF return back up anterior to the medulla, that really result in the CSF coming down, have difficulty coming down the spinal canal and have trouble coming back. And then I assume that if there's nowhere to go, the CSF will go into the middle of the spinal cord. There is a central canal of the spinal cord. Maybe that will try to function as a drainage pathway for the CSF to return. Once you take that part of the blockage out, basically, since you cannot take out the extra tissue of cerebral tonsil, you take the bone and the muscle out, make it extra space, so the CSF have space to move down, and they therefore have space to move back up, and then there's less CSF going into the middle of the spinal cord, which is 5 years later resolved.